to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Priyanka Ahuja, and today I'm going to talk about analytes as predictors of adverse pregnancy outcomes. Significant links have been found between maternal serum levels of analytes evaluated early in pregnancy and subsequent adverse pregnancy outcomes in nulliparous gravidas or women who have not given birth previously. Yet, they cannot be used as clinical biomarkers to predict adverse pregnancy outcomes, either alone or in combination with maternal clinical characteristics, the latest study published in AJOG has found. The study led by Samuel Perry et al. Tried to research placental physiology and identified novel biomarkers in relation to adverse pregnancy outcomes, including preterm birth, preeclampsia, small for gestational age, neonates, and stillbirth. Maternal serum samples were collected at 2 study visits, 6 to 13 weeks and 16 to 21 weeks, and levels of 9 analytes were measured. The analytes measured were vascular endothelial growth factor, placental growth factor, endoglin, soluble FMS like tyrosine kinase 1, A disintegrin, and metalloproteinase domain containing protein 12, pregnancy-associated plasma protein A, free beta-HCG, inhibin A, and alpha-fetoprotein. The primary outcome was preterm birth between 20 weeks and 36 weeks 6 days gestation. Secondary outcomes were spontaneous preterm births, medically indicated preterm births, preeclampsia, SGA neonates, and stillbirths. A total of 10,038 eligible gravidas were enrolled into the NUMO M2B cohort, from which a nested case control study was performed, comparing 800 cases with preterm birth, 568 with preeclampsia, 406 with SGA birth, and 49 with stillbirth, with 911 controls who delivered at term without complications. The researchers noted the following results. Levels of each analyte generally differed between cases and controls at 1 or both visits. However, a less than 2-fold difference between cases and controls in all comparisons were noted. Receiver operating characteristic curves generated to determine the relationship between analyte levels and preterm birth and the other adverse pregnancy outcomes were relatively low. Logistic regression modeling demonstrated that the area under the curve for predicting adverse pregnancy outcomes were greater using baseline clinical characteristics and combinations of analytes compared to baseline characteristics alone. But the area under the curves remained relatively low for each outcome. We have found significant associations between maternal serum levels of analytes evaluated early in pregnancy and subsequent adverse pregnancy outcomes in nulliparous gravidas. However, the test characteristics for these analytes do not support their use as clinical biomarkers to predict adverse pregnancy outcomes, either alone or in combination with maternal clinical characteristics, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.